Dr. Jackie Kinley is a psychiatrist who's developed revolutionary treatment for mental health. She has discovered how the human spirit can be the most powerful medicine. She believes that human relationships can actually change and heal the brain. Our guest at the table is Dr. Jackie Kinley.
Dr. Jackie Kinley, welcome to At the Table. Now, I wanted to ask you, what made you decide to go from your family practice and move into psychiatry?
Well, I'd been a little bit unsettled in medicine, I think, ever since I started. You know, I was very interested in people, a little bit disillusioned with the practice, you know, the machinery of the hospital and everything, and the technology, and the patients feel sometimes, and it's a lot of good people in medicine, but sometimes you feel like the patient gets lost.
Right.
And so I was always very interested in understanding people. You know, I've always been that kind of person. So, and I wanted to get out of a medical model, and I wanted to get more into a psychological model to really understand the mind, the person behind the disorder.
Now, when you were making the switch, you had a family tragedy happen.
Yeah.
Can you tell me about that?
Yeah. So when I was, you know, I had moved out to Vancouver at one point because I had a brother there, and you know, it was sort of a very strong family, a lot of overachievers and successful, you know, good people. But one of my brothers was a little bit lost and trying to find his way, so he'd moved out to the West Coast, so I moved out also. And got married to my husband, and I got pregnant, and we were going to have a baby, so we came back to the East Coast. And I was preparing to make this decision to go to the States. And just before we left to go to Colorado for me to train, we got the phone call that my brother had killed himself. And it was in some ways it wasn't a surprise, you know, because we knew he'd been struggling, but even in a medical family, we had no idea how to help him. You know, and we'd actually, and this is one of the reasons why when I went down to Colorado, I did my analytic training, because I had done some work as a sort of, that they called a whole person doctor at the Nova Scotia Hospital, you know, sort of working alongside of psychiatrists as a GP, but I knew that they were practicing biological psychiatry, which was they were medicating folks, they weren't doing therapy, they weren't spending a lot of time, and that's not everybody. It was the predominant paradigm here.
So does what happened to you personally continue to influence how you think about patients and how you treat patients?
Absolutely, absolutely. Yeah.
How?
Well, because I think, you know, with the case of my brother, you know, he's a good-looking guy, you know, smart, in college, graduated from college, you know, looked like, you know, in the world that we live in, he should have everything together. Right. But he was emotionally pained and suffering and tormented, you know, and so people that he would see would, you know, give him a pill and off he'd go or whatever, and nobody actually, I don't think, really knew him and understood him and felt his pain. And that's what it's about. It's about being there with your patients and actually experiencing the difficulty. I've talked about moving into their anxiety and feeling their pain and helping them to heal, as opposed to giving them a medication to get rid of those symptoms. And it's not that I'm against the medication. I think the medication can be useful in the short term, but it's really not a way to, you know, bring somebody out of illness into a place of wellness.
So what kind of symptoms and disorders are you seeing in the mental health community today? What's prevalent?
Well, you know, it's interesting because the disorders that we see are culturally bound, right? So the olden days, you'd see the hysterical patient, you know, in the Freudian times, and, you know, because that was sort of the flavor of the week, right? And, you know, as times change, the disorders change. You know, bipolar disorder, all of a sudden, you know, you get a dysregulated, you know, sort of culture, right? You know, and so we started to see more of that, you know.
So is it that doctors are just picking that more often, or is it society that's making that?
I think it's co-created. You know, I think, yeah, it's a system, right? And so I think what's happened is, you know, as we've lost those kind of external boundaries in terms of the church and the, you know, universal value system, you know, and the sort of solid ground is that people are less grounded. right? So we tend to see a lot of anxiety, right? We see a lot of mood instability, right? Because mental health develops in relationship, right? And if you don't have solid, real-time relationships, you don't learn how to regulate your body. You don't learn how to settle yourself down. You know.
And that's happening more in society, you think, now that these don't help?
Absolutely. Well, and the other thing is, you know, the relationships that people do have, whether they're online, you know, it's one word back and forth.
Right.
You lose all of that other contextual contact, right? So really, you know, most of our
facial expressions, emotions, that sort of thing.
Yeah. So you don't feel the response of the other person. So you have your own response, you know, with the computer, but you don't develop empathy, compassion, connection emotionally with the other person. Now that doesn't mean that you don't feel angry or frustrated, but you don't feel the other person's feelings.
So it's one-sided.
It's a one-sided relationship. So, you know, then in addition to the symptom spectrum that you see in terms of more lability and mood, people can't settle themselves as well. My experience with youth is they are more fragile. They're not as resilient because, you know, parents try to buffer them, protect them. Adversity in life is necessary to build strength, right? You lift weights because you're pushing against something and your body
gets stronger.
Gets stronger, right? But we don't have the same challenges. And in fact, so we're buffering, so we're overprotecting them on the one hand, but on the other hand, you know, it's like anything goes, right? So they can have whatever they want. So we have these sort of entitled, you know, boundaryless youth, right? So, you know, they're sort of, you know, lawless. They you know, so we see more. Whereas, you know, saying earlier, I think in terms of there used to be a lot of borderlines. We see a lot of borderlines, but now we're even seeing a shift. At least in the group that I see, you know, I see very, very sick folks, seeing a shift to more narcissistic and antisocial, which is the lack of relational understanding, right? Yeah.
Well, we're going to touch on that when we come back. We're going to take a break. We'll be back with Dr. Jackie Kinley at the table. We're back at the table with Dr. Jackie Kinley. So we were talking before about narcissism. Why do you think that is so prevalent?
You know, I think part of it is that we don't have any role models. Right. You know, angry people like a narcissist and an antisocial, you know, anger is not a bad thing, right? And usually there's anger because they feel like things should be a certain way, and
frustration,
and they're not. Absolutely. Right. And so I think that you're seeing it in response to a lack of respect for the authority structures that should be in place.
Right.
You know, I mean, in terms of our legal systems, our medical, our judicial, our military system now.
So is society making us sick?
It's not a cause and effect. It's not a one. It's sort of a perfect storm. You know, it's that we're living in a society that is unsustainable in a sense, where, you know, we want all these things, but we don't want to have to work for them. We live in a virtual kind of life. And we can't carry on like that. So something has to give. And I think, you know, people need people to stay well. And the more disconnected we become, sort of there's an old saying, it takes a man to make a man sick, but it also takes a man to make, or a woman to make a man well. Right. And so as we become more disconnected, we become more dysregulated, right?
So what's the solution? What are people being treated? How are they being treated, and what are they being treated for? Well,
you know, there's a lot of different options in treatment in psychiatry. It's the same way in medicine. It comes back down to, you know, the first step is to sort of glue the person back, and so the medications can be very helpful. If somebody's down, to lift them up, or if somebody's psychotic, to sort of close them down, or if somebody's, you know, so those can be helpful. I call them ego glue.
Ego glue,
because they glue the person back together.
Right.
Once the person has settled, that's when the work starts, right?
Do a lot of people just say, well, you're better, and move on? Is that a part of the problem?
Well, if you focus on symptoms, if you see the symptom as a problem, right? If you see the symptom as the problem, once you've treated the problem, that's it, right? But if you see the symptom as problematic and the result of a deeper issue, then you treat the symptom and then you deal with the problem.
Right.
But we deal with sort of a quick fix, a kind of Band-Aid culture, right? So people don't actually get to the core of the issue. So that's where psychotherapy and deeper work, you know, kind of has to happen, and to reconnect with other people, right? So
Are we seeing more people with symptoms like that being disconnected? Is that the most prevalent kind of disorder we're seeing?
Well, I think disconnection is not a disorder. Disconnection is just sort of the way things are. As a result of the disconnection, you see people more anxious, less grounded. Relationships ground us. Real relationships are grounding. And when we lose those, we become anxious, dysregulated, and angry. And it's not just connection, because people say, well, you're connected if you're online. It's a lack of really belonging. People respond to that in different ways. It's kind of the fight, flight, or freeze. You know, the fighters are the narcissists, the antisocials, they get angry, and then the borderlines, right? And the sort of flighters are the dependent, the people pleasers, the sort of preoccupied, anxious.
Are they both? Is one easier to treat than the other, or does it just depend?
They're different.
Right.
The treatments are different, so you have to move them all to a central place. So with one, you have to sort of melt them down. With the other one, you have to kind of shore them up. And with the other, with the sort of, skittish, you have to actually get them in the room. It's more about safety, right? So, and then once they're in the room with you, then you want to work with them. Then you want to connect with them.
We were talking earlier, you're saying it's core strength, whether it's in your body or in your mind or in your heart. Can you explain that?
Well, I was saying, I view the brain as a muscle, and there's a whole area of research in psychiatry and neurobiology, neuroscience, about neuroplasticity, which is really about the brain, the brain's ability to be rewired. But your brain
can be done.
Absolutely. Absolutely.
Does everybody think that, or is that a new?
Well, I mean, people would recognize, the cognitive neuroscientists would recognize that learning is rewiring your brain. You're learning new pathways. So yes, now it is becoming more recognized. I mean, but it was a stretch. I mean, up until, 30, 40 years ago, the brain was felt to be static. That your genes were your destiny and nothing else changed, right? So you were born with what you were born with, and
just deal with it and try and treat it, not cure it.
Absolutely, and that resiliency was a sort of trait. You either had it or you didn't. Wow, you're a resilient person, great. But now we've actually learned is that resiliency develops across the lifespan, right? And so the question is it's not kind of what happened. It's not why they got there. It's what are you going to do with them now? And how are you going to help them to, and one of the things is neuroplasticity, changing somebody's brain, requires their mind. So you need their active attention. So what somebody attends to is influencing the structure of their brain.
So you determine your brain and your mind are different.
Well, yes, I do, absolutely. And I think that the brain is similar to the body, right? Is something that our mind can influence, and that our mind is something that's beyond our brain and beyond our body, right? And that we can harness the energy of our mind to influence our brain. It's sort of mind over matter. It's when you fix your intention on something, you can make it happen, right? You can actually call things forth, right? So in the same way you say, well, I'm going to run a marathon, right? Well, you look at your body and your body's not fit, so what do? You fix your intention and you get out there and you start to condition your body, right? And so then, over time, it takes time to build that structure, and then you're able to do it. It's the same thing with your brain, right? It's about focusing on what you want to do, and then actively healing your relationship that you have with yourself and your relationship with others, right? But people often, in psychiatry and in medicine, we don't often do that internal work because it feels uncomfortable for people. It makes them anxious. And medicine or psychiatry is all about decreasing anxiety, right? Whereas we're all about, great, let's move to that area, because then you know that you're in a hot spot. You know you're in a place where you can do some work.
And we'll be back with Dr. Jackie Kinley at the table. Stay with us. We're back at the table with Dr. Jackie Kinley. So we were talking about getting to the hot spots, as you call them, of mental illness. Explain that.
Well, I was going to say, the other thing I sometimes say is getting at the heart of the matter, right? Because that's really what it is. I often say that mental illness is less a disease of the brain than it is of the heart.
Explain that. What do you mean?
Well, because, you know, I mean, the theoretical model that we use is that, and I go back to it takes a man to make a man sick, it takes a man to make a man well, is that, you know, most of the patients that we see, you know, that have symptoms are inherently very sensitive. Right. So and what happens is you know, over the course of time with hurts, people don't like to, you know, feel hurt. They try to be strong and sort of swallow it or not deal with it. Yeah, they suppress, you know, would be the, you know, word. And so what happens is those hurts sort of build up and it forms almost like an abscess. We talk about sort of an abscess because, you know, metaphorically it works, but it makes really good sense to people. And you say, oh, somebody, they know how to press my buttons, you know, they know the hot spots, they know how to get under my skin kind of thing, right? And most of the medications are designed to kind of cover over that and sort of
toughen the
deal
abscess,
with,
right?
Yeah, or deal with the, you know, difficulties, but they don't actually go in and get it out, right? And so that's what I was saying, is that once you get the person in the room, then you want to work with them and you want to be able to access, you know, what are the drivers of their difficulty.
A lot of resistance, I would expect. You spent your whole life trying to protect
That's exactly right.
what hurts you. How do you get someone to open up?
Well, the relationship. Right? I mean, you know, is that, you know, the first thing is that, first of all, you need to, you know, have a solid sense of what it is that you're trying to do. And you need to be able to do it safely, right? You know, I sort of say it's like open heart surgery. You don't go in and sort of do open heart surgery without a sterile setting. You wouldn't do it out on the street, right?
And this is what your program does.
Well, it's about getting people to access, you know, those core issues. And you know, they're often deep kind of moral, psychological conflicts, you know. When people are hurt, you know, by people they love or other people, you know, feeling angry towards people that you love feels wrong or bad, or and so people feel guilty. So it's guilt and shame about who they are and what they feel, kind of seals the tomb. You know, I sort of, you know, and so people don't like to go back and experience those feelings. But that's what the program's designed to do. I often say, though, it's not just what you take out, because it's about kind of, you know, breaking down those old scar tissue, right? That's sort of the neuroplasticity. You sort of break those dendrites open, right? But then it's like, how do you rewire them?
And
right?
you're convinced that can be done, right? You can
absolutely,
really...
absolutely. You know, it's fascinating. Oftentimes when we meet with people and we talk about them, they say, well, this is the first time I've ever talked about my feelings. This is the first time I've ever actually experienced my feelings in my body. You know, like, what do you mean my anxiety is different from my anger? People often, when they're angry, they're just anxious. They don't actually feel the emotions. They haven't learned how to differentiate them, which is a huge part of the work, is to differentiate your feelings and feel them so you can access the core hurt, which is really at the core. And I say that grieving, right, is actually like, it's when the abscess pops open and the pus comes out, right? And I always say to people, and it's disgusting, but I say the healing's in the poison, right? Is if we don't access that energy, if we can't get that out, right? You know, we can put all kinds of things over top, but we really haven't got at the core of the issue. And you need that energy in the service of healing, right? Because rewiring the brain, you know, it takes work, right?
Now, since you've been doing this therapy, can you sort of outline maybe one of your most memorable cases? Do any of them stand out, any kind of breakthroughs?
Well, we've got a couple of cases, and this shows you the tension in the body. I mean, there was a woman recently who had seizures, right? So she was in the hospital having seizures all the time. We had a fellow recently who had tic disorder, Tourette's and tics. And I know this is controversial. People say, well, it's a biological disorder. But the reality is once these people, you know, when they first came into the program, overwhelmed, even the idea of going near the feelings, they get anxious, and seizures and tics. But once we actually were able to access a breakthrough and actually start to drain some of that pressure, that tension that's held in the body, seizures stop, tics stop. This disorder that they've been medicated for 15, 20 years, gone.
So right? the body and the brain.
The body knows how to heal itself. It's about using the mind to influence and to access those spots, and then you can actually drain that tension, and then the body knows how to heal itself. It's about kind of liberating the sort of, you know, natural flow of things. You know, we have a natural order, you know, and what happens is we get out of sync with that. You know, it's like we resist knowing, you know, what we don't want to know, right?
But how intense is that kind of therapy? I can only imagine that if you've been trying to suppress emotions and feelings like that for your entire life, maybe since you were a kid, well, you're going to be pretty resistant to letting those go.
Well, yeah, but I think that's the power. One of the things that we do, people do it individual sessions, but we do it in a group session, right? Because, you know, the healing power of the group, you know, is that from other people, you know, in the same way that, you know, when you eat food, you have physical needs, you eat food, but emotionally you have needs too. You need to feel safe and cared for, respected. And so the power of the group is they are able to nourish each other.
Right.
So that they come into the group and they feel safe in the group. They feel it's almost like a net. I remember one patient actually said, you know what, you can feel your feelings and we're all here and we'll hold your heart. You know, it's a safety. And then they can experience their feelings and they can, you know, be validated and consolidated by the feedback from other group members. So it's exceedingly powerful.
And you see this as a cure, not a treatment.
Well,
right?
It's a step along the way, because the challenge is, right, is that you start to realign and then you go out into the real world. And one of the difficulties is you go out in the real world and then you have people, you know, things don't work out and people can be re-injured, right? So it's sort of like riding a bike, you know, is that this old way of being has become second nature. You know, you have your first nature, right? And then you develop a second nature, which is sort of false, the way you sort of protect yourself. And we're talking about reclaiming your first nature.
Right.
But what happens is that they go back out in the world
things
happen and they tend to slip back. And so it's about consolidating the new connections that the brain makes. It's about consolidating that second nature. And the challenge that we have is that we live in a world that actually doesn't support that and actually tries to, you know, close things up and not deal with the truth. And you know, so yeah, and sometimes you feel like you're swimming upstream. But, you know, I'll never stop what I do because I love the success of the patients.
Dr. Jackie Kinley, thanks so much for coming in. We really appreciate it. Thank you.